Our mission is to connect students to health careers, health professionals to communities, and ultimately communities to better health, so that the outcome of our people, our 850,000 people in South Georgia, will have access to care, and it's good care, and they'll be healthier because of it. So we actually bring students from all over Georgia and other states to our 38 counties and actually give them learning experiences with physicians or other community teachers so that they may stay here 6 weeks and they learn about healthcare and about their profession, but they also integrate into our community. And ultimately would choose to return here. And so that's how we measure our success, is people who are actually coming back, practicing in Southwest Georgia. When the call for proposals came out, we were not just in it for ourselves. We were interested in trying to receive this award so that if we got it and they built the system for us, we could share it with the other 5 AHECs in Georgia so they could benefit, and ultimately that it would be shared with national AHECs so that they also might pursue this opportunity. What we do is pretty complex because there's so many pieces of information. TechBridge had to learn what we were about, and they had to learn it in depth. And it was amazing to me how quickly they caught on, how they could translate what we were muddling around trying to say and make it into this system that answered our needs. Our information is accurate and we can be consistent. And then we also have the ability now to demonstrate to our stakeholders outcomes. And before, they were limited outcomes. And suddenly it's the depth of what we can report and give back to our stakeholders. It is really unbelievable. So I think we look better, they feel better about partnering with us. So I just think it's improved relationships. So all of a sudden we have all the AHECs joining us, and they could visualize because we could show them our data system. We could show them how easy it was to do a report, how easy it was to know where every student was in your county region. So they have now all bought into the idea of collaboration and using the system. So all AHECs are in different points into incorporating that into their own system. There are 240 some odd AHECs nationwide, and what we're going to do is take it beyond state but go national. After we instituted Salesforce, it was like the lights came on. Suddenly, we always knew we were pretty good at what we did and we felt like we were successful, but all of a sudden we really realized how successful we were because information was no longer in a silo. Everything related to each other. So we discovered that a student that we worked with in middle school and then maybe had some contact with in high school is now back practicing in our region as a physician or a nurse practitioner or a PA, but we never knew that. Without TechBridge and Accenture, we would be in a cave, a dark cave, rubbing 2 sticks together, trying to start a fire.